Today I'm here to provide you with information about diabetes. What is diabetes? Diabetes can be categorized into two different variations. Type 1 diabetes is a chronic form of diabetes involving an insulin deficiency where the body produces no insulin and is categorized by excess of sugar in the blood and urine. Type 2 diabetes is caused by the inefficient use of insulin, which the body produces but does not utilize. In the 4th grade, I was diagnosed as a type 1 diabetic, which is a diabetic whose body produces no insulin. This means the islet cells in the pancreas are no longer productive. Full of concern, confusion, and extreme worry, my parents and I had many questions. How do you diagnose diabetes? What treatment is used? And is there a possible cure? According to the American Diabetes Association, there are a total of 25.8 million children and adults in the United States that have diabetes. This makes up 8.3% of the population. Unless you're familiar with the disease itself, it is not easily diagnosed. Children and adults may experience many of the same symptoms at onset. These symptoms include frequent urination, loss of weight, and excessive thirst. To prove a person is diabetic, doctors will do a blood glucose check. If the level is over 130, the patient is said to be a diabetic and admitted to the hospital for treatment. Treatment for diabetes is manageable. Maintenance for adults and children that have diabetes tends to become second nature. Checking one's blood glucose frequently, possibly 6 times a day or more, is not a suggestion as much as a requirement. Diet and exercise go hand in hand. When you are admitted to the hospital, you will have a dietitian who will come in to see you and give you a strict ADA diet requiring you to take in no more than a certain number of calories a day. She will also encourage you to exercise as much as you can within the first 6 months, and many diabetics will follow those guidelines. However, most will become more relaxed in following those guidelines as time passes. Injections or pumps are used to provide needed insulin for the type 1 diabetic. Persons with type 2 diabetes can take oral medications, follow a diet including exercise to maintain a satisfactory blood glucose level. Most cases do not require insulin injections for type 2 diabetics. In regards to research, according to a Sweet Life editor, Carmel Allison, there is hope for beta stem cell regeneration, in which stem cells would be differentiated into beta cells and implanted into diabetics so that we could essentially regrow our defunct pancreases. Also in the hope of a cure, there have been experiments involving islet and pancreas transplants. Denise Dador, editor of Healthy Living, states that so far the success rate involving islet transplant patients is 65% compared to 80% for a full pancreas transplant. Pancreas transplants are typically reserved for those who have serious diabetes complications and is often done in conjunction with a kidney transplant. In conclusion, the life of a diabetic is not easy, but can be managed through the careful maintenance of blood glucose levels, diet, and exercise. One needs to be well educated and follow the advice given by their doctor to maintain a healthy and active life. If all of the above is done, success in living with diabetes can be accomplished.